Okay. All right, we will call the February meeting of the Health and Human Services Committee meeting to order. I need to read a preamble before we begin our meeting. This meeting is being conducted under the extraordinary circumstances of a public health emergency, COVID-19, and under Governor Cuomo's Executive Order 202.1, without permitting public in-person access to the meeting, authorizing the meeting to be held partially or completely with members appearing by remote conference call or similar service, and the meeting is being live streamed via the web and recorded, including the participation of the members appearing by remote link. We'll now take a roll call of the board members present.
Legislator Grant?
Here.
Drake?
Here.
Maxon?
Here.
Harris?
Here.
Doldo?
Here.
Nabawanik?
Here.
Peck?
Here.
Legislator Johnson?
Here.
McBride?
Here.
Reed? Monticelli?
Here.
Calarco?
Here.
Cantwell?
Here.
Gero?
Well, I'm sorry, I'm here.
Okay. And Gray?
Here.
All committee members present and all but one board member present.
Okay, very good. So we have to approve the minutes from our last committee meeting. Is there any corrections to the minutes? I believe Mr. Doldo messaged me. He had one correction that he wanted to make note of.
Yeah, I'd just like to make a correction. The Fire Advisory Board meeting was in September 21st, not October. Just to have that in the minutes, that's all. Thank you.
We'll make that correction. Thank you.
Thank you.
Okay. Any other comments or changes to the minutes from the last committee meeting? Okay, hearing nothing else, we'll move forward to our resolutions.
First resolution this evening is authorizing agreement with the City of Watertown for transportation services for the elderly.
We have a motion and a second, please. Mr.
Make a
Ferris.
motion.
Okay, Mr. Ferris and Mr. Nabawanik. Any discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Our second resolution this evening is authorizing agreement with Samaritan Medical Center for the use of facilities to the medical examiner program.
May I have a motion, please?
Motion, Doldo.
Second?
Grant.
Thank you. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Opposed? Carried.
Third resolution is amending the 2021 county budget relative to additional revenue from the Red Lake Horowitz Foundation for Family First Readiness Funding.
You have a motion, please?
Motion, Doldo.
Okay, we have Mr. Doldo and Mr. Nabawanik. Is there any discussion? All in favor?
Aye.
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 Opposed? Carried. Well, I believe that concludes our resolutions for tonight. So, are there any other comments, questions, or concerns that any of the committee members wish to bring forward? Okay, I think if everybody had a chance to see some of the emails that came out today, we are getting COVID vaccines once again. And so I think we get back on track and continue with that endeavor. So as far as continuing to be vigilant, and our numbers are trending in a good direction. So unless there's anything further that the chairman wishes to add, we'll probably be done with our business.
Unless somebody's got any questions. Our clinic booked in less than 45 minutes today. So the clinic for Friday. So I suspect we will have our clinic for Tuesday, the next clinic. We're waiting on the commitment from the partners. I think if I don't recall correctly, but I think we have 400 doses at Public Health, and then the other partners, there's 100 coming from North Country Family Health, and we're waiting on a commitment from Samaritan and Carthage, I believe, to see what they have left. So we'll be preparing the clinic tomorrow, and the bulletin will go out again tomorrow for Tuesday. So don't anticipate it being open very long either. So
is it destined to split the same as it was this time, Scott, for the two different groups?
Hold on, Bill. I don't. Hold on. You want it? Tomorrow is. Real quick. Or excuse me. Trying to think when. Oh, that's not the one. Okay, so Tuesday looks like we're going to have 400 doses there, 100 from there, and we're waiting on Carthage and Samaritan. It is going to be. That's Tuesday. What is Tuesday? I am not.
We're still pretty well getting consistently the same amount of dosages week by week.
Ever so slightly increasing. I mean, we were 1,500. Week 10 that didn't show up, but is here now, was about 1,500 doses in the county total. That includes the Kinney Drugs location. Week 11, which is the week we're operating in right now, we had about 1,700 doses. So the number's starting to turn up a little bit. We anticipated even increasing even more. So Tuesday's clinic will be 1B, the workforce of 1B, and it'll be the 1C comorbidity patients. And the 100 doses that are coming from North Country Family Health, I think that's to be determined in terms of the population that we're going to serve there. Some of these doses come in with specific designations of what we're going to do. So we're waiting to hear on theirs. And then we're waiting to hear the balance from Carthage and Samaritan. So I mean, maximum will be about 670 will be a maximum if everybody comes in at the right numbers. But it will be possibly something a little bit less than that, but still that's a big clinic. For 600, that's going to be a very busy. That's going to be a very busy day.
Mr. Gray?
Speaking, yes.
I think Bill asked what category are being vaccinated.
Just
I'm not sure.
Yep.
Yeah, he answered it.
I just answered that. Yep. So 1B workforce. One more time. 1B workforce. The 1C comorbidity population. And there's still 100 at least that have a designation to be determined. So we have to wait and see if they have a designation that's associated with it when they reallocate it over to us. The process we have to go through. It's complicated. In short.
Now, Mr. Gray, there's one little caveat with the 1B group. I had shared with you an article from earlier today and this is a comment that I keep getting issued my direction too from both on the farm labor aspect, but also on food processors, that particular group, has not been opened up to be able to go get vaccinations, even though they are a part of the 1B group. And, even when you've got President Biden saying that that is a priority group, it's in the control of the governor to be able to declare what groups are priority. So obviously now we have an inconsistency, and I keep on getting questions from that particular segment. When is our chance to get vaccinated? So I know you can't answer it, but if you can continue to press that one up the food chain, that would be helpful.
So I can, we get the question every day from somebody from some sort of subgroup. Okay. Right now, I can tell you the primary focus is on people facing occupations. There's a lot of occupations that are considered essential. I don't particularly care for that word. I just, but there's a lot of occupations that are essential. The primary thrust of the vaccination for the 1B workforce, because we'll just leave it at that because everybody's essential. Okay. The 1B workforce has primarily been people facing occupations, right? Plow drivers are essential, but they're not in a public facing mode every day, right? So they can be more isolated in their vehicles and stuff like that, and there can be distance when they're in the highway barn or something along that line. So there's measures that can be taken place, right? There are other positions. Soul care provider was brought to us today, right? A soul care provider is not necessarily a person that's qualifies under the 1B workforce, but healthcare providers, because they're patient-facing people every day, are necessary so they don't transmit the disease. That's the virus. So that's kind of where you'll find the delineation, John, is more public-facing positions. So, not to say that anybody's more essential than another. It's just.
Yeah, I understand. I understand the train of thought behind that. Certainly, you will find in certain occupations that it's not just a matter of an individual dealing with the public, as per say a retail environment, but certain occupations you're working shoulder to shoulder with individuals, and that's just a part of the work mode. It's just like somebody working in somebody's milking parlor. I mean, there's not really room to social distance because you're right next to each other on one side or the other dealing with the cows. So there is no social distance per se, other than working from one end to the other. So that essentially and it's that type of workforce which has a concern. But
Right. Yep.
so I guess if they want to further open up things and communicate that message and talk about it, it's one thing to absolutely talk about individuals who are dealing with public, which public is certainly a high risk place. Then you start talking about, okay, who's in a workforce which is in a high contact workforce among coworkers, would be another avenue to be able to consider when opening up groups. Proximity of contact because of the way the workplace is designed.
Yep. Understood.
John, you have a question.
Okay. I can't see who's raising their hand, unfortunately, on my device. So
Bobby Campbell.
please announce yourself.
Thanks, Chairman Peck. It's Legislator Campbell. So
Thank you.
I think, Mr. Gray, I think an example you gave me the other day of forward-facing or public-facing would be a grocery store clerk, would be very public-facing. John, I get your point that it's hard to social distance in a parlor. No disrespect, but there's probably only 2 or 3 people in your parlor versus the grocery store clerk seeing 2,300 people possibly in a day, but not making light of your situation at all. I totally understood your point. My question I do have for Chairman Gray, could a business be essential and the employees not be? So not have access to vaccine?
Yes, yeah, there's
That was posed to me today.
yeah, the designations, so, right, the designations of businesses being, so everybody's hanging on the designations of businesses being essential when we were through the process of being on pause and then reopening. That means that the business and the function of the business is essential, but it doesn't necessarily translate to the employees within that business being essential, right? And I'll give you a case in point. We've had a couple of automobile either repair businesses or parts businesses in their business, much like their business was considered essential, okay, in terms of being open during the pause, but their employees, that doesn't translate when it comes to quarantining the employees, or it may not translate into vaccinating the employees, okay? There's a different level of essential at that point, if you will. That's why I don't use the word essential, right? I don't like the word essential. So the question came down to, well, my business is essential, so my employees do not have to quarantine, and that is an incorrect assumption. There are few exemptions that are done for quarantine purposes, and it's usually where the risk of having those employees quarantine is greater, having them out of work than going to work with an exposure, right? Law enforcement, paid firefighters, those are some of the healthcare workers, some of the critical people that public health has put back into work under quarantine conditions. But when they go to work under a quarantine condition, their employer is notified that they're under a quarantine order, which means that they have to be kept separate from the rest of the staff. They have to take extra precautions, if you will. And then they can only go to work and return home, to and from work. There's no stopping at the convenience store or anything like that. So they're under very strict measures if they're released to go to work when they're under quarantine. And that's rare that it happens, but there's been exceptions made. So, but that doesn't translate into employees for important business that was considered essential by ESD doesn't translate into the actual staff.
Okay, so it could, again, the business could be essential, but that wouldn't translate into the employee qualifying to get a vaccine. Is that correct also?
Or quarantine or vaccine, that's correct.
Okay, all right, okay. Yes. You probably had the same conversation that I had today from one of my constituents. You mentioned parts and auto.
Correct.
Thank you.
Yes.
Thank you.
Yep.
Okay, any other comments from anybody
Anthony
else?
has a question.
Somebody is that Anthony over here?
No, it was a mistake. I thought my hand was up and it wasn't. I just wanted to make sure it wasn't up.
Okay.
I'm good. Thank you.
Okay, any other comments from anybody else? Questions? Okay, hearing none, I'll entertain a motion to adjourn.
Motion, Doldo.
Second, Ferris.
Okay, thank you very much. We are adjourned.
Mr. Monticelli, you're on.
Well, thank you, Chairman. I'd like to call to order the County Standing Committee on Finance and Rules. There are for our February 2021 meeting. At this time, I'd read this preamble to the meeting, or permission to have the meeting, and it is being held under the extraordinary circumstances of a public health emergency called COVID-19 and under Governor Cuomo's Executive Order 202.1 without permitting public in-person access to the meeting, authorizing the meeting to be held partially or completely with members appearing by remote conference call or similar service. And the meeting is being live streamed via the web and recorded, including the participation of the members appearing by remote link. And with that, I would ask if there is any changes to the minutes of last month. Hearing no concerns, I'd just like to tell you that I got my first shot today, scheduled for my second shot in March. Don't I look a lot lighter? All that worry off my shoulders. Does anybody remember the swine flu of '76? All I had to do was go down to the fire hall for that shot. But anyway, I digress. Okay. I guess onward to resolutions. County Administrator?
If looking at the screen, I think everybody's here. Did Bobby get off? Bobby? Yeah. Otherwise, we'll assume everybody's still on. First resolution of the evening. Authorizing agreement with Maximus Incorporated for professional services relative to the development of cost allocation plans.
May I have a motion, please?
Motion Nebuonic.
Second, Gerald.
Thank you, gentlemen. Discussion on the motion? Hearing none, all in favor?
Aye.
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 Opposed?
Aye.
No opposition, and motion is carried. Second resolution?
Next resolution is reappropriating funds from Center for Tech and Civil Life and amending the 2021 county budget in relation thereto.
May I have a motion, please?
Johnson.
Thank you. Second?
Drake.
Thank you. Discussion on the motion? Hearing none, all in favor?
Aye.
Aye.
Any opposed? Motion is carried.
Authorizing the chief elected official local agreement under the workforce I'll try that again. Authorizing the chief elected official local agreement under the Workforce Innovation and Opportunity Act of 2014.
May I have that motion, please? Moved.
Johnson.
Legislator Johnson, can I have a second?
Nebuonic.
Thank you. Any discussion? Hearing none, all in favor?
Aye.
Opposed? Hearing none, it's carried. Okay, on to 4.
Establishing time and place for a public hearing related to the 2020 Community Development Block Grant process.
May I have a motion, please?
Drake.
Thank you.
Johnson.
Gerald.
Sounds like possibly Drake and Jero?
That works.
Okay. Discussion on that motion? Hearing none, all in favor?
Aye.
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 Any opposition? The motion is carried.
Next resolution is requesting the New York State Legislature provide level funding for the Northern New York Agricultural Development Program in the fiscal year 2022 state budget at $300,000.
Gerald.
Thank you, Legislator Jero.
You're
Yeah,
welcome,
well.
sir.
And Nebuonic, was that? The second?
Cantwell.
Cantwell, thank you, Legislator Cantwell. Any discussion, gentlemen and ladies? Hearing none, all in favor?
Aye.
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 And opposed? Motion is carried. Okay, moving on to the General Services Sponsored Committees. The General Services General Services Committee.
Everybody's doing that. First resolution is reappropriating funds from various unspent grants relative to the Fire and Emergency Management Department and amending the 2021 county budget in relation thereto.
Thank you. Motion, please.
Johnson.
Legislator Johnson,
Nebuonic, second.
thank you. Discussion on that motion? Hearing none, all in favor?
Aye.
Opposed? Motion is carried. Number 2.
Authorizing implementation and funding in the first instance 100% of the federal aid and state Marchicelli program aid eligible costs for transportation federal aid project and appropriating funds therefore and amending the 2021 budget and capital plan accordingly.
Motion, please.
Gerald.
Thank you.
Drake.
Thank you, Mr. Drake. Discussion on that motion? Hearing none, all in favor?
Aye.
Opposed?
Aye.
Aye.
Any opposition? Motion is carried.
Reappropriating funds from various unspent homeland security grants relative to the sheriff's department and amending the 2021 county budget in relation thereto.
May I have a motion to, please?
Drake.
Cantwell.
Sounds like Drake and Cantwell. Discussion?
Yes, as always, I'm a no on this for the same reasons I always have been.
Any further discussion? Okay, all in favor?
Aye.
Aye.
Opposed?
I'm opposed.
And the motion is carried.
Next is authorizing intermunicipal agreement with the city of Watertown regarding the fiscal year 2020 Edward Byrne Memorial Justice Assistance Program and amending the 2021 county budget in relation thereto.
Little music in the background, anybody, for the meetings?
It's a giveaway, Legislator Johnson. We knew it was you.
Thank you.
It's too much fun. Do I have a motion?
Sorry.
Do we take the music as a motion?
Did you move that, Legislator Johnson?
I did.
Can I have a second?
You couldn't tell?
I'll second it.
Thank you, Legislator Darrow. Thank you. Any discussion on that? Hearing none, all in favor?
Aye.
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 And opposed? Motion's carried. On to the one resolution sponsored by the Health and Human Services Committee sponsored resolution.
Amending the 2021 county budget relative to additional revenue from the Red Lake Horwitz Foundation for Family First Readiness Funding.
Motion, please.
Motion number 1.
Thank you. Discussion? Hearing none, all in favor?
Aye.
Aye.
And opposed? Motion is carried. Well, that's our motions. There's 2 reports, county clerk and the health benefit report. I was at the health benefit virtual meeting. There's a lot of new faces from UMR, and it was, it's well represented by labor. So, I mean, people are hearing what they need to hear. It's just that the news is never good news. Costs are just going the wrong way. And it seems like the driving force to that is they refer to it as specialty drugs. That's the title of the big expense. With that, is there anything further to bring to the committee?
Mr. Chair?
Yes, sir. Legislator Nabawana?
Thank you, Mr. Chair. Would I be wrong to assume that with the numbers getting back to what they were before we went to Zoom, that next month's committee meetings will be in person at the county office building?
It wasn't discussed, but I'm sure it will get discussed. At this point, I have no information to that. I mean, the chairman is here and the county administrator is here. Gentlemen, can weigh in?
At the present time, under the state executive orders, it's extended, this kind of a meeting process is extended through about mid-March. So that would assume for the moment through our board meeting in March. What happens at that point going forward remains to be seen.
Well, I'm going to have to
Thank
invest in, probably have to invest in pants for those meetings.
Mr. Monticelli, this is John Peck. May I ask a question?
Yes, Legislator Peck.
On the health benefits report, it's at least a positive sign that January was substantially less this year than January of last year. I'm kind of curious, though, when you talk about specific drugs, is there anything with our health benefits that says generics are first option, first priority, or is it up to the patient's choice to choose whether it's brand name or generic?
Well, the costs are different, and it's how it's prescribed is also an issue. I don't know that a person I don't know that they can request what they want from a doctor. The doctor prescribes what he prescribes, and if a generic's available, it's the cheapest form. But they can prescribe, if the doctor prescribes something that isn't generic, and you choose to get generic, you'd have to have that approved by your doctor. You can't make that decision on your own. So there's three price ranges for drugs, and how it's prescribed drives the boat, drives the how it goes.
We encourage generic as much as we can. I think Mike would agree. The cost for employees, if it's generic versus the other two models that Mike is referencing, becomes much greater. So there's somewhat of a disincentive from that standpoint. It's going to cost the county a little bit more, but it's also going to cost the employee more.
Legislator Peck, the specialty drugs, there's this whole program, and I'm sure it makes sense at some level, but it seems convoluted to me. A drug is prescribed. The drug is way too expensive for the person. Somehow the drug company subsidizes the drug that they're selling you.
Yeah.
I don't want to pass any judgment on that because it ends up sounding like I either don't appreciate it or make it. I don't want to judge it. I'm just saying it is convoluted, and that's how it's done. And I certainly, if you like to come to one of those meetings, you might enjoy it. I don't know if enjoy is the right word, but you might find it informative. I didn't mean enjoy. I did mean it, but I didn't.
Well, I have no doubt that it would be informative. I don't know if I would come out happier or more depressed, though. But it could at least have a better understanding. So, the reason why, they certainly ask because, drugs is always something that seems to have its own, it rears its own issues at some point, whether it's locally or nationally. So when you mention that it's a matter of specialty drugs, that piques my interest because, on a personal level, my wife is also one who has taken I guess you could consider a specialty drug for, the particular condition she is dealing with. Interesting enough, though, that particular drug has been on the market for over 20 years, and yet, as you would commonly see in the marketplace, something that's been out for a while should generally go down in price, and yet this particular drug has always maintained its same price or slightly increased. So it's an interesting issue within medical pharmaceuticals in itself. So I guess I digress now at this point, but it's just something of a curiosity just to understand where that issue is being driven from, whether it's particular health issues that are driven towards a particular specialty drug, or whether it's somebody's preferences and wanting to prefer a name brand versus a generic. That's all. Thank you, Mr. Monticelli.
The specialty stuff, Legislator Peck, is like a level unto itself, and it's very it's limited uses, but it is very expensive. But then there's the formulary. I can't think of the three titles, but there's generic, formulary, and whatever brand name, I guess. And so there are three levels for just like most drugs that people would generally take. Diabetes and hypertension are the two big ones. You get into other illnesses, which cancers and I dare not go into the medical areas because I really don't know the diseases that require those. But those specialty things are very expensive and they're used by very few people, but they are life-saving drugs. They do have a subsidy program, which is, as I said, convoluted, where I'm going to charge you $1,000 for something you can't afford it. Okay, we're going to charge you $1,000, then we're going to give you $900. What? How do you give? Just don't charge me. But that's not the way it's done.
Well, that sounds like that's more or less the business model, is that you need to have the high price to drive your sales for your own business and reporting purposes, and then you go in on the back end and give a massive discount or rebate, and then it kind of washes out in the books in another line item in the accounting. So, it's, profits and sales are what drives, stocks and businesses. So.
Absolutely. The people at Proact, they seem to be, I'm very impressed with the young man that comes to that meeting. He explains things very well to people who are non-medical or non-pharmaceutical. And then Mr. Cahill from Losian Cahill, can't think of his first name, but he's like our advisor. And he's also very informative. These people have a deep understanding of it. And I mean, I feel confident when everybody leaves that the county is being treated fairly. So on that note, I would ask, is there anything further for the committee? If not, may I have a motion to adjourn?
So moved,
Please.
Johnson.
Thank you. And a second?
Trey,
All in favor?
Aye.
Aye.
We are
Aye.
adjourned. Thank you, one and all.
have a good evening.
So long.
Good night.